Good morning, my name is John with the Pine Tree, and I have the great pleasure of being here with Larry Cornish from Mark Twain St. Joseph's Hospital. Thank you, Larry.
You're welcome.
And this is one of our little things where we kind of invade somebody's office and take, make them feel uncomfortable. That kind of stuff.
Intimidate me?
Yeah, no, I don't know about that. I think it's the other way around. No. But thank you. I guess this is hopefully something we're going to try to do like once a quarter to kind of give you an update on the happenings at the hospital, what's going on, what to expect, some good things and that type of stuff. So
Perfect.
Thank you.
Perfect. Yeah, there's a lot going on.
Yeah.
Maybe we can provide some insight into some of the healthcare issues that the community might have at the time. Who knows? But yeah, it should be very informative and maybe fun today.
Yeah. Now, I guess one little thing is this one, we're taping this one a couple of days after, and you still have one more session of the Teddy Bear Clinic.
Teddy Bear Clinic, yes.
Teddy Bear Clinic, yeah. This was a wonderful thing. You should have seen this place a couple of days ago. It was completely overrun by kindergartners running all over the place, and it was very nice. And what they did was pretty special.
You want to talk more about that?
Well, if you want, yeah.
We're actually, let's talk about October in general, because we have done a lot of events in October, starting way back the first or second Saturday of October with our health fair, our big health fair here at the hospital campus, where we give free flu shots and do discounted blood tests.
Right.
And this year was the biggest and best that we've ever had.
You know, over 1,000 attendees?
Yes.
Wow.
Over 1,000 attendees. We did about half again as many flu shots, about half as many again blood draws for $25, which is a steal compared to what the regular price is. And so we did some other vaccinations. I can't remember what they are. And it was just a great day, though. We had stuff for the kids to do. We had about 50 community organizations that were all health-related that were here, from smoking cessation to spas and masseuses, and it was just a great day.
Right. Now, are some of those services, I mean, with the pricing and stuff, is that targeted in some ways at some people who are marginally insured or things like that at all, or not necessarily?
Sure.
Okay.
Yeah, a lot of the times, seniors especially, who may be on fixed incomes, depend upon us for their flu shots or blood draws.
Right.
The flu shots are free.
Right.
Although we do encourage donations,
Right.
but we advertise that they're free, and the blood tests can cost you, some cases $200, $300 if you have them done it through the family practice physician. So at $25, it is a huge benefit to those seniors who are on fixed incomes, and even with Medicare reimbursement may not be able to afford them. So it's great community benefit.
Super. Now, you guys have a new president fairly recently, don't you? Is that?
We do. We do. And we're extremely excited to have Feliciano on board. Feliciano Havron is our new hospital president, as you may know out there in the audience. Our previous president left us about this time last year, November of 2006. And we had an interim president with us, Larry Phillip, through that time until about May of 2007, and then Feliciano joined us. And Feliciano, he's a kick to begin with, but I've never worked for anybody with so much energy, out of his whole family actually, with his wife Johanna. And so we're real pleased to have him on board. He's done some great work already, including the Teddy Bear Clinic, and he wasn't involved with the health fair too much, but because that was pretty much an ongoing event.
Yeah.
But he's done great with physician recruitment and helped us to hire some quality nurses and develop some programs that are valuable to the community, and just lead us in the right direction. So we're very pleased to have him on board.
And we saw his wife was involved in the Teddy Bear Clinic.
Yeah, she was our event coordinator. And the Teddy Bear Clinic, you're jumping back and forth a little bit here. The Teddy Bear Clinic, we did Teddy Bear Clinic last Monday and Tuesday, and we have 2 more sessions this coming Monday and Tuesday. And the Teddy Bear Clinic is where we've invited all of the kindergartners from Calaveras County to come to the hospital, learn about the hospital, take a tour, have a great lunch, get back on their bus and go away. And it has been, actually it's been a lot of hard work, but it's been a lot of fun.
Yeah.
And the day has been wonderful for the kids, their parent chaperones, their school teachers. Some of the school teachers have been doing lesson planning for the week leading up to the event, so they've kind of been indoctrinating them a little bit about the hospital environment.
Yeah.
But the whole purpose is to talk to the kids about the hospital and healthcare in a comfortable setting,
Right.
so that they feel better when they come to the hospital, where the intimidation may go away a little bit. And it's been great. This is an annual event, obviously, and
Great.
Johanna
Great.
Hutterone is our coordinator. She's done this before in the hospitals that her husband has been president in, and it's worked out well. So great community stuff.
And if you have a chance to, there's some priceless little clips, like some things that only kindergartners would say. Like we had one where there was a young girl that asked if she'd ever been to the hospital before. And she said, well, yeah, I got some shots. And she went, they gave me here, and then she went, and they also gave me one here, So she was, but it was really, there were some priceless kindergartner moments, it was very fun.
I heard that one of the days, Monday or Tuesday, I don't remember which, we were talking about some of the, how well the kids were behaving and everything. And all of a sudden, one of our tour guides mentioned that on her tour, they were sitting down having lunch, and all of a sudden she got a piece of pizza in her face. One of the kids, I don't know how it happened, but just unloaded this piece of pizza and just slapped her in the head. It was a kickoff. It's been very good. And then, so that happened in October as well. And then yesterday we did a mini health fair. Now, during the summertime, we did mini health fairs at Angels Camp for their picnic, not the picnic in the park, but their farmer's market.
Sure.
We did one up at Murphy's for the first Friday of the month, and we did one up in Arnold with the music in the parks with the whatever the music group
Cedar
is.
Center there.
Yeah. And those have been very good. But yesterday we did a health fair at Ironstone for their employees.
Oh, nice.
And we provided the flu shots. We did sugar glucose testing, and provided them with a lot of health information about the hospital and health in general. And all went well. I think we gave out 56 flu shots, so somewhere in the neighborhood of 60, 65 maybe visited with us from both Ironstone and Couts Farms, and it was a great day out there. And that's what we're trying to do more of, is getting out in the community.
Outreach, more out there.
And that's one of the reasons we're excited about doing this today, is because we want people to really know, we're not a community hospital, but we are a community hospital, and that we're doing these type of things in the community to support healthcare, and it's great.
Good.
Yeah.
Good. Now, I guess in the community, as far as your not-for-profit, what type of what type of community benefit I think that's a good thing to see it as a not. I'm probably saying this wrong, but I think it's important for you guys as an organization that you're a not-for-profit as well. That's part of your culture, right? Isn't that part of the service?
Yes. When the hospital was first, however it came about back in 1951, it has always been a not-for-profit district hospital. It remains a not-for-profit district hospital today, although we're affiliated with Catholic Healthcare West, which is a not-for-profit organization. In order to maintain that not-for-profit status, we have to show the government and the community that we do a lot of community benefit. That a lot of the things that we do, we don't get reimbursed for. That it is community outreach, it's education, it's providing services to those people that are maybe on fixed incomes, Medicare, Medi-Cal. They don't provide full reimbursement. And so we just finished up our community benefit report for our last fiscal year. I got it right here in front of me. And the bottom line here is that the net benefit that we provided to our community for unsponsored community benefit is almost $8 million.
Wow.
$8 million. That includes the cost of our services versus the reimbursement that we get from Medi-Cal and Medicare, the delta there, we basically write off. It also, we have traditional community charity care in the neighborhood of just under $400,000. And then we do tons and tons of things like the health fair,
Mm-hmm.
or being out at the Calaveras County Fair with our nurses 24
Right.
hours a day for
Right.
5 days a week,
Right.
and providing some sort of community benefit there. So we report all these things in our community benefit report, and the bottom line, once again, is about $8 million
About 8 million.
went back to the community for uncompensated or unsponsored community benefit. And that is really huge. And,
Oh, yeah.
you know, we're real proud of that. It's not something that we brag about.
Right.
We've never bragged about it. It's just something we do. But it's important for the community to recognize that we do provide this benefit.
And that sum is, I mean, if you divide that by the population of the county, that's a pretty large sum per capita.
It's big, huh?
Yeah.
Big, huh? And if you look at what we do for our community, and then you compare that to the same percentage of other hospitals in their
Right.
community,
Right.
I think by and large you'll see that we actually are way above the median
Yeah.
for the unsponsored community benefit back to the community.
And also I want to say thanks to you guys as well, because I know there's on all the community, you know, Calaveras County is special if you're, you know, not a local watching this, is that per capita, the community involvement and just the generous nature of this county is pretty amazing. You know, it's, you know, from the Relay for Life activities,
Right.
just from all the general charitable nature, I guess, of the county per capita, it's pretty amazing as far as the donation levels and stuff like that in this county.
You're 100% right. I mean, that's why we're here.
Right.
You know, everybody that's listening, I'm sure that all of us will agree that the reason we live in Calaveras County is because of one piece of that is the community cares and how
Mhm.
much we give, all of us, back
Mhm.
to the community to make it a better place. And that's
Yeah.
one of our slogan for the last 3 years has been, it's a good life.
Yeah.
And it's a good life in Calaveras County because of the stuff that the community does
Right.
and gives back, and the
Right.
stuff that we do.
Right. And I guess to move on a little bit, now how's you know, you see a lot of the news and stuff about nursing shortages and that type of stuff. How's it affecting you guys here locally?
Well, 2 years ago, it was affecting us very drastically. Last year, which was a little bit better year, when you have to have a certain amount of nurses on
Right.
staff
Right.
during any day to meet the needs of the patients, and there's a ratio
Mhm.
that you have to have a certain number of nurses for a certain number of patients in all areas:
Right.
emergency room, med surg, intensive care,
Mhm.
and each one of their ratios is a little bit different. But we have struggled, just like most hospitals have struggled, with trying to get enough nurses to support the number of patients that we have.
Got it.
Last year, we supplemented our regular employees
Mhm.
by having nurses from what is called a registry. And you pay a premium. You actually have a contract with the registry, and if you need a nurse, you call the registry and they supply you the nurse. And the difference between a typical nurse's salary and the premium you pay for the nurses to the registry cost this community, our hospital, about $1 million last year.
Wow. So
That's
just
huge.
that's just the spread.
That's just the difference.
Wow.
This year, we have, through excellent recruitment
Mhm.
and excellent retention on the nurses, we have almost eliminated that delta. All of the nurses that we have, or almost all the nurses, we still have a couple areas, but for the most part, we've wiped that out.
That's a big spread.
Yeah.
That's significant.
It is significant, and all that bottom line again then gets turned over to new programs and
Right.
services for the community. As a not-for-profit, you know, it doesn't go in somebody's pocket.
Mhm.
It goes right back into providing capital equipment and other things that the community needs.
Great. Now,
So-
now as far as physician recruitment, you know, and how does that has that going at the same good pace as the nurses on the nurse
It's
side
a
of
little
it?
bit slower.
Okay.
Because there's you know, you have a nurse shortage, you also have a physician shortage out there, and physicians have changed in the last 20 years.
Yeah.
You know, with the Kaiser
Yeah.
model and
Yeah.
and everything else. But and we have had a few physicians leave the organization in this past year, retirement,
Mhm.
slowing down the pace, so
Mhm.
maybe their offices are closed. And so we've had to step up, but we still have holes in our specialties for physicians that we're trying to fill, and those are a major focus in our strategic planning to bring more internal medicine physicians, more family practice physicians. We need a couple specialists in a couple of key areas.
So we need to sell the Calaveras County package to them, you know, the skiing at the top, wine tasting at the bottom, and all the rest of that.
Well, you know, that's interesting because further down on the list we have this little blurb here to talk about marketing. And one of the things that we're going to do this year is that we're going to actually advertise for physicians in national magazines.
Right.
Specific to the lifestyle that we have here, you know, like powder for snow skiers. Well, maybe in the Powder magazine there will be an ad about Mark Twain St. Joseph's Hospital. Live your dreams right here in Calaveras County. So we've got 3 national magazines that we're working with right now.
Good.
And in the next couple of months we'll see some ads in there, recruitment ads for Mark Twain St. Joseph's Hospital.
Well, I think in some of the physician side of it has to be just indicative of the healthcare market in general. I mean, because I know in a previous job I used to work for a medical software company, and it was run by a physician that was, I mean, with the reimbursement model for physicians and stuff like that. I mean, this past 10 or 15 years, there's been a little turmoil. I mean, just as in the physician market in general. I mean, is that?
And we see that, and it's getting worse. Physicians, and that's one of the bad things about living in Calaveras County, because the physicians want to enjoy the community. Right. They don't want to be on call 24 hours a day, 7 days a week. They want to work 9 to 5, and then spend the time with their family, or go skiing, or go boating, or go fishing, or go kayaking, or whatever the case may be. And the model's changing. And we're changing too. We have to change. So we're working through that, and the physicians that are most senior are working through that.
Sure.
And the young kids that are coming on board, which we need, are
go into medicine.
The double hat says, "I want to be a doctor." So it's interesting.
Now, as far as overall plans for the hospital, Val, what do you got planned out here the next few months?
Well, you know, most of the right now, most of our capital projects or funding for capital projects are going into equipment. This last year we spent well over $1 million on our PACS program. Now PACS stands for, and I have to write this down because I can never remember it, Picture Archiving and Communication System. And what this is that all of our imaging area with CT scanner, X-rays, mammography, we're all going to digital on those. We already had the digital equipment, but now we're linking together in a network. And everything is now being able to be shown on monitors with extreme clarity rather than the old films. And it allows us digitally to store these pictures, if you will, and then anybody, anywhere, who can have access and needs to know on the network can bring up a film of somebody's broken leg, and they don't have to be physically here. To provide recommendations for treatment. It's instantaneous. So the whole goal here is it's much clearer, it's instantaneous. You can do comparative shots side by side on the monitors, and you can archive it for future reference. And it's the bottom line is that the patients can get earlier treatment, which means they can be back to their lifestyles faster, and the outcomes are much better. It's huge for any hospital, and we're there. You know, we're right on the front line.
And correct me if I'm wrong on this. From just a little bit of stuff I've gone over the years, now most of these X-rays and stuff are like they're not really a JPEG, like was it a DICOM? Isn't that the format?
Boy. You're asking me something I don't know.
Well, a couple of things. I may be wrong, but the density levels of some of your X-rays and stuff are just huge. So, for example, the size of these files, the raw files on these things. I mean, what I was going to try is this is a significant IT investment. As far as just on the IT side of medicine, just because if you think of these file sizes, from what I've got into on some of these X-rays and stuff, I mean they're huge. I mean, just like one image can be, if I'm correct, I think like 150 megabytes for like one. I mean, they're huge. Picture. I mean, they're just huge.
I would believe that because if you can put an X-ray, hard copy X-ray, next to a monitor with the same picture on it, the same picture, the same leg, everything's the clarity, the definition, the contrast is so much better on that computer image than on the X-ray. That yes, you're right. This probably is just packed with bits and bytes and everything else.
Yeah, the pixel densities on those is just incredible. Yeah, anyway.
But it's really good.
Didn't want to swerve into a nerdy technical side of it.
But it is pretty exciting for us geeks, isn't it?
Yeah, but I think it's important for people to know. I think more and more of medicine is, you have significant IT investments that, they aren't cheap, and that technology obsoletes every few years, and it's like the treadmill you got to keep running on.
Yeah.
It's
yes, in most of your capital investments for IT, it's a 3-year capital versus a 5-year capital. You got the depreciation is extremely fast in IT these days, and it's going to get better and better and better. We're going to digital mammography here before too much longer, and that's going to be significant for the women in Calaveras County, primarily the women. Some guys use it too, but it's going to be significant, and it all ties together. So our new imaging center that we're going to be working on down in Angels Camp is going to be all digital, using the same technology.
Tied into the hospital
the whole
system
network,
as well. Right.
So it's going to be big.
Now, one little odd. Now, as far as inside the hospital, have you guys moved to an EMR, like an electronic medical record, internally yet?
No, not yet. We're working on it. That is again a very high dollar investment. Fortunately, we didn't do it earlier because most people that have gone to it have found that it's in its infancy, and there's some issues with it. We think that there's a good product out there now. But Catholic Healthcare West, there's 42 hospitals involved with Catholic Healthcare West, and they have this huge corporate team working on EMR. Some of the hospitals have gone to it. They've identified the best product. They know how to implement it, and I think within a year, maybe 2, we will all be EMR throughout Catholic Healthcare, including us.
Right.
But it is huge to get this medical record. Essentially, what it is, if I understand it correctly, it's a medical record that all of us, our medical records will be digitized, just like our X-rays are, and that medical record is available to anybody, your physician, wherever he may be. If he's on vacation, and he can pull up your medical record, and if you come to the emergency room, that medical record can be brought up. It's accurate, it's timely, everything is up to date on it, and you can get the latest and greatest treatment, even though you might have been there a week ago and got a different medication that will show up.
Right. And the only reason we brought it up because I guess the fires reminded me of it, because I know in wake of the Katrina stuff, there was a lot of discussion, if I recall, in the medical industry, that the practices and the hospitals that were on an EMR had a much quicker return to normalcy, because a lot of times if it was an office that had paper charts and stuff like that, they were gone. Yeah. And I think as long as they had off-site backups with their electronic stuff, it's not perfect or anything, but it was. Just the fires reminded me of their return to normalcy was significantly quicker.
Yeah, that's interesting, because if those people are displaced, if the record is gone, the hard copy is gone, it's gone. But if they had the electronic medical record stored somewhere on a server and had to move to Texas from Louisiana, that new physician in Texas could access that record and bring it current with whatever treatment he's doing for the patient in Texas. So
I think we've gone off topic here a little bit.
I know, but it's fun. It's fun. What else we got? Let me tell you, patient confidentiality is big across the nation.
Right.
One of the capital projects that we're going to be doing right after the first of the year is to provide some privacy cubicles down at our admitting station at the front of the hospital. And the whole purpose of those is so that when you come into the hospital to register for your procedure, say you're coming in for a colonoscopy.
Right.
You don't want everybody in the lobby to know that you're here for a colonoscopy, or you want some measure of confidentiality.
It's going to be invasive enough as it is.
Yeah, true.
I'm sorry.
Well, okay. But so these cubicles, you'll actually go in and talk to the registration clerk, and it'll be more confidential than the way we're providing it today, which is what you expect from a hospital these days. And hopefully it won't be too obtrusive or invasive for you as you're sitting there, and you'll still feel comfortable. You'll be in a room with the registration clerk, and that's going to be nice. Something that we've been working towards for a couple of years now.
That's nice that you're conscious of the patient's feelings on the privacy, because so much of our life now is just kind of exposed anyway. It's just
with technology, it is very easy to expose. In our community, where most of the people in the hospital have grown up seeing their neighbors day in and day out at the hospital as patients, that's not acceptable anymore.
Right. Well, thank you. Anything?
You're welcome. Let me look at my list here. No, I think we're about covered it. Yeah. I did want to talk, just one more, wrap things up with a little bit of a marketing thing. We are running a campaign. We actually have been doing it for about 3 months now, that we keep rolling through the radio stations and the newsprint about Did You Know?
Right.
And the Did You Know is to identify something that we do here at the hospital that you would be interested in hearing about. For instance, we just released this information about the community benefit number.
Yeah.
And that's the Did You Know that we're going to start running here. Did you know Mark Twain St. Joseph's Hospital had over almost $8 million in unsponsored community benefit in the fiscal year 2007. Wow. So these type of things are going out every 2 weeks, and just a little reminder about what we do here.
I guess one little last question. This is what we've had some questions from viewers and stuff. Status of OB, is where is I know. Is there anything you can say on that at all?
Yeah, I think we can probably bring you up to date quickly. It's been a year since we closed the OB, and again, the reason we closed it in the first place was because of patient care. We just don't have enough birth age moms in our community to have enough babies born at our hospital to warrant recruiting for 2 OBGYNs, as well as the staff to support it on an ongoing basis, the nursing staff. So we closed it, all because of patient care, nothing else. Not economics, not recruitment, nothing. It was all because of patient care.
I guess so people understand the reason. Is this part of the county problem? Because you see lots of times in our county schools there's actually enrollments dropping and stuff like that. Is it just the demographic of the birth age percentage of population, just probably period? Isn't that one of the things? Or
yes, it's pretty much the demographics of it. And there's some more things that have changed. Again, it's physicians don't want to be on call 24 hours a day, 7 days a week. Neither do nurses.
Right.
So, so we made a conscious decision to close the birthing center about a year ago. Department of Health Services, which we are licensed through for that service, asked us to come back to them within a year and tell us what we're going to be doing.
Okay.
It's a board decision. We do have a board of trustees here at the hospital. They're right now reviewing everything to determine what we want to do. Do we want to keep it closed? Do we want to keep it open? I think that decision will be made here very quick.
Okay.
In the meantime, we are recruiting for a group of OBGYNs.
Oh, great!
In the community. They are going to be actually in our brand new medical office building across on the campus, but across the creek.
It's a pretty facility.
Yeah.
Very nice.
Thank you.
Very pretty.
And they're going to be able to provide mom support up to the day that she has to deliver.
Right.
If we don't do the delivery here, then the mom will go to St. Joseph's or Amador or a hospital of their choice for the birth, and then they can come back up here for and see the OBGYN for future services.
So the majority of the care would be here regardless of whether the actual birth took place.
Only 2 days out of the community, which is much better than what we've seen in the past.
Right.
Much better care.
Right.
So we're looking forward to that. Dr.
Good.
Gill and his group we're getting ready to sign some ink on
Oh,
these.
good.
So that's
super,
good.
super.
Out of Stockton.
Well, I really appreciate you sitting down this morning. I know, I know there's a lot of interest in this topic, and we really, and thanks for all you do at the hospital.
Oh, you're
I
welcome.
appreciate it.
Thanks for inviting me to chit chat for
Sure.
a bit, and we hope to do this again next quarter.
On the Teddy Bear Clinic stuff, if you haven't seen it, there's some little priceless clips and stuff that kindergartners in action. There's that. It's pretty cool. So if in addition to watching this, go back down on the site and have a look at some of those clips. It's a lot of fun.
Yeah, he's right. It is pretty neat. It was a lot of fun. Thank you, John.
Thank you very much. Thank you.